This is Dr. Caudle Miller with Dr. Miller's Guide to Neurology. Today we're going to talk about carpal tunnel syndrome. Your hand bones are called carpal bones, and there's a tunnel. If you think of my watch band here, it's the tendon on top of this tunnel, and there's a nerve that goes through. So if this is the carpal tunnel, the nerve's here. So you look at our children, they could drive a truck through theirs. But this tendon thickens up and presses on the median nerve. Now the median nerve supplies sensation to the first three fingers and half of the fourth finger. The ulnar nerve provides sensation to the lateral part of the ring finger and the little finger. So this is a median nerve injury. People classically describe waking up at night with their hands asleep and they just have to shake them. They have burning, tingling, numbness, aching in the wrists, decreased temperature sensation. You really hate to wait too long because if they get atrophy of this thenar muscle, the surgery just doesn't work. It keeps them from getting worse, but they don't get back to normal. Hands just feel like they're asleep. They have morning stiffness, much worse with repetitive movement. People drive, see people driving in cars and trucks, long distance truck drivers, their hands go numb. Very, very clumsy. The hands feel very swollen. So the treatment is, first wrist immobilized at night. When you sleep, you bend your wrist. So wrist immobilized at night. Sometimes steroid injections, anti-inflammatories, physical therapy, or chiropractic. And we do a nerve conduction and EMG study. The nerve conduction, if it's abnormal and slow, I treat people a very brief period of time, maybe 4 to 6 weeks. If they're not better, I recommend a carpal tunnel release. Timing is critical. If you wait till a patient gets thenar atrophy, they will not get well. 95 to 98% of people, if they're treated early, will get well from carpal tunnel. Very successful surgery. It's very common in diabetes, so diabetics commonly have carpal tunnel. Their success rate's probably more in the range of 50%, but we still want to do it in a diabetic. So that's carpal tunnel syndrome. So subscribe, comment, and more later.